Now we're moving to a company, or rather, I should stop calling them companies, to a research group. This is a group who started with a mission to improve insulin delivery for people with type 1 diabetes mellitus. Fada Medical from the University of Galway has developed a novel diffusion technology that can extend the wear time of infusion set cannulas, supporting consistent long-term insulin pump use. Our next presenter is Robert Wiley from Fada Medical.
I'd like you to think back to the last meal that you ate today. Before you ate that delicious meal, I'd like you to imagine that you needed to take a drug to combat the effects that this meal would have in you. The method that you used to take this drug was painful, you needed to carry several spare parts, and you were anxious that it could fail at any moment. Now I'd like you to imagine that you had to do this for not only this meal, but every single meal for the rest of your life. This is the reality for the 18 million people with type 1 diabetes worldwide, who need to carefully and continuously intake multiple doses of insulin alongside their meals every single day. This is a 24/7 disease, and getting this insulin into their bodies is a lot of work. However, insulin pumps have significantly improved treatment outcomes over more manual approaches. Despite this, only 1 in 10 people with type 1 diabetes are actually using these pumps. So why is there such low adoption? The reason is due to the failure of the most critical component of the system, the infusion set cannula, which is a small needle inserted into the user's abdomen and is the only way to get insulin from the pump into the body. It has a short lifespan of only 2 to 3 days, and 40% of the time it fails even earlier than this, which means most users go through at least 136 of these components every single year. This high frequency of change means constant interruption to care. And extending the lifespan of the infusion set is the final piece of the puzzle towards fully automated insulin delivery. And Fada Medical have the solution. Using our patent-pending diffusion technology, we have developed a 30-day infusion set cannula, which will limit the interruption to insulin delivery from an insulin pump. Extending the lifespan to 30 days will mean a reduction in painful insertions from 136 to just 12 per year. This technology can be integrated into existing insulin pump systems to positively impact treatment outcomes and potentially eliminate over $1 billion in excess healthcare spending due to wasted insulin, extra infusion sets, and associated healthcare costs. Earlier this year, we demonstrated the safety of this technology in preclinical studies, and we are gearing up towards a large preclinical study at the beginning of next year. We're also aiming to spin out of the University of Galway in 2023 with a €2 million investment to continue our technical and commercial pathways. This is just the beginning of Fada Medical. Come join us on our journey as we accelerate our mission to solve the final piece of the puzzle of insulin delivery, so that the focus of the next meal can be the meal itself, not the treatment. Thank you.
Hey, Robert, come on over. If you'd said we are going to change it from a situation where you move from 1 every 2 days to 1 every 4 days, you'd say, well, that's a significant improvement. To move it from once every 2 days to once a month seems an extraordinary improvement. What's the technology that allows it to be possible?
So really, Anton, what differentiates us from competitors is that we're actually tackling the root cause of why these cannulas fail. And the reason that this happens is that when something is implanted into our bodies, a very complex series of events is initiated where our body recognizes the invasion of a foreign object. And what it does in order to protect us from that foreign object, it sets about creating a barrier around it. And this is called the foreign body response. But what it doesn't realize is that's potentially preventing much needed medication from getting in. And so what our novel diffusion technology does is it gets the insulin past this barrier to extend the delivery of insulin for an extended time.
So in the same way as like the titanium implants allowed the bone to fuse to them, it's effectively that the body doesn't attempt to reject whatever system you use.
Yeah, so it looks to protect us from it.
How significant or how large do you think the market is, and how easy do you think it'll be to be reimbursed? Because we've seen issues already with just the cost of the insulin itself, particularly in the US market,
Oh yeah.
never mind high-tech delivery systems.
Absolutely, and like this is a really hot topic in the US at the moment due to insulin being so expensive. And like Joe Biden, for example, has come out with the Affordable Care Act, and there's a lot of talk around this at the moment. So imagine having to spend so much money on insulin, and your sort of delivery system isn't providing you the best that it can. I suppose in terms of the market, it's a $2 billion market at the moment, but we're only, I suppose, catering for 10% of the total people with type 1 diabetes. So there's a severe commercial opportunity here for expansion, and we believe that our solution can have that impact.
Robert, thank you very much. Much appreciated.
Thank you
Stay
so
there.
much.